So, hey guys, good afternoon. It's already noontime. How are you doing today? It's so nice to be here again. Thank God for life. Thank God for health. Yeah, I was really sick last week. I don't know if any of you was able to. Well, I know some of you were able to notice because I got messages after, and well, I mentioned it also. I forgot about that, but yeah, thank you so much for joining me today. Thank you, my darling Ugoma. You are such a blessing to me. Thank you so much. Uh, it's nice being here. I'm so happy. I was really sick last week, so sick. I mean, the only reason I was able to come and do the infertility presentation last week was because I already made a promise, and this is something I have committed myself towards doing. So I mean, I barely could. I was going out of breath, but yeah, it's a commitment, and I love what I do. I am so happy. I am so happy every time I have to do this. So, thank you so much for joining me. I will be talking real quick about first aid emergencies, first aid and emergencies. So, how do you manage minor emergencies? You don't want to, go to the emergency room for a little cut. Your child has a nosebleed. You don't want to rush to the ER because, hey, what's going on? The more we go outside, the more we get ourselves exposed to whatever is out there, COVID, whatever we want to call it. But yes, we need to keep ourselves in the house as much as possible. And I figure that if we stay in the house, it doesn't necessarily cut out the chances that there could be little emergencies, there could be a bleeding, there could be a puncture, there could be a cut, your child could fall off while playing. You just need to know the basic things. Your parents, you're trying to fix something at the backyard, on the roof of the house, and somebody falls down. What do? So I know very much that we're in the computer age, cell phone, internet, everything goes on the internet. Yes, it's wonderful, but when you have someone who is in the middle of an emergency, what do? Do you just stand there, grab your phone, take a few selfies, and try to post on Facebook or Twitter or whatever, or do you help the person? What do you do when you're faced with an emergency situation? So, first of all, I want you to understand that the reason for first aid is to preserve life. We're trying to make sure that somebody doesn't die, right? We're trying to make sure that, we save a life as much as we can. Then, secondly, we want to prevent further injury. So if someone fell down, for instance, fell from a tree, for instance, you don't want to leave them there. You don't want to just take pictures or start crying for help or start praying, because the person could get even more injured in that situation. And we're also trying to avoid infection. So if someone has a wound, for instance, you want to make sure that you protect that area. You protect it from any further infection or from any infection getting into it. We also want to promote recovery. If there is a tissue damage, you want to, the goal of first aid is to enable the tissue repair as much as possible. All right. So first thing, before you ever try to do first aid, you want to make sure that the environment is safe. So let's take, for instance, someone got hit by a car in the middle of the highway, and oh my God, you're trying to help the person. Are you gonna go in the middle of that same highway and try to perform CPR? No, you're gonna try as much as you can to get the person out of the way of oncoming vehicles, because first of all, we already have a victim. You don't want to be the second victim. So if there's an accident, if there is a fire, a burn, whatever, you want to make sure that you get the person out of the way. Now, if there's like an electricity or like some kind of lightning, you want to get the person out of water, because if you're trying to go help someone who was electrocuted and they are on top of water, then you're probably going to be the next victim, right? Okay, I'm just saying. But anyway, you don't want that to happen. So you want to try as much as possible to access the environment, make sure that it's safe enough for you to provide any kind of care. Secondly, you want to remove the person from the danger. So if there's water, if it's a fire, if it's a burning building, you're not going to stand there and just wait for 911 or the fire team to come around. You're going to try to save the person from the danger that they're already in. All right. Now, I know, and I've done this a few times, when we're faced with some kind of emergency situations, the first thing you want to do is act, right? Yeah, I had some time ago, I had a patient who yanked off his internal jugular artery catheter, and that's a major artery, and this guy was bleeding. When I came in, he was already passed out on the floor, everywhere was blood, and the first thing that came to my mind was stop the bleeding. And yes, I could have done that, but what happened? I thought about it for a minute. I could be introducing infection into that guy. And what if he had hepatitis C, B, something that could be, blood transmitted by blood? I could, in the process of trying to save someone, and I'm catching something. So when you find yourself in a scene where you need to perform some kind of first aid care, you want to make sure that you protect yourself and protect the patient. Wash your hands. Wash your hands, wash your hands, wash your hands. If you don't have water and soap, you can use a hand sanitizer. And I don't want to teach us how to wash our hands, but you'll be so surprised some people don't know how to wash their hands. So when you go to wash your hands, I know it's an emergency, but hey, we're trying to protect the patient, we're trying to protect ourselves. So go to wash your hands, put some soap, like real soap on your hands, and try to rub your hands together in between your fingers, under your nails, wash around your wrist. Make sure, and then sometimes not sometimes, we're taught that you need to sing happy birthday for at least 20 seconds, right? Happy birthday to you. It might not be that nice, but just sing a happy birthday song. Or I always tell my students, the least you want to sing is Amazing Grace, right? That's like 2 minutes. Yeah, but sing the happy birthday song. Make sure you wash your hands very well. Make sure your hands are clean. And then dry with a dry towel. Don't go to an emergency situation with a wet hand. Dry your hands. Clean towel. And then if you have gloves, please put on your gloves, especially if you're going to be exposed to blood or body fluids. So that's the next thing you should do. So it's very important that you wash your hands very well and then proceed to offering help. Okay, so I'll talk about some of the major major emergencies that we have in the home front, at work, in the backyard, on the streets and all that. The first I'll talk about is nosebleeds. Excuse me. I know a lot of people have had nosebleeds or have seen someone who had a nosebleed. So if you have someone who is having a nosebleed, what do? I know it's typical for some people we used to hear that when we were kids. They'll say, pinch your nose and tilt your head backwards. But let me tell you something. If you pinch your nose and tilt your head backwards, there's every tendency that you're going to be swallowing blood, or the blood could actually go in the trachea, and that's not what we want in the trachea. We want only oxygen in the trachea. So if you happen to have a nosebleed, or you have someone who has a nosebleed, pinch the tip of your nose, or the top of your nose right around the bone, and then tilt your head forward. Okay, and you can do that for 5 to 10 minutes, and that should be able to cease the bleeding, except if the individual is on some kind of blood thinners where it becomes difficult for the blood to clot normally, and in that case, the person needs to be sent to the hospital as soon as possible. All right. So the next thing I want to talk about is any kind of bleeding. So let's say someone gets a cut. They're trying to cut some nice salad, trying to cut some nice vegetable in the kitchen, and then all of a sudden the finger goes with the vegetable, right? We've seen that happen. Or someone just has any kind of bleeding episode in an accident, any kind of bleeding episode. The first thing you want to do is stop bleeding. Stop that bleeding. As much as possible, put pressure, hold on to that spot for at least 15 minutes. It might be a little difficult, but if you don't have a gauze or, a pad or something, just make sure you stop bleeding. Tie something around there, whatever you can do to stop that area from bleeding, and that will enable clotting. So when you're able to stop bleeding, then you can take the patient or the individual to the nearest emergency room. All right. So, but remember, you're only trying to help. You're not trying to introduce more infection. So, if your hands are dirty, you don't want to use a dirty hand to, try to get your hands as clean as possible, and then wrap the area with gauze, clean gauze, or any clean cloth that you can find around to just put pressure on that spot, so the patient doesn't bleed to death. Because time is of essence. Like I said in the stroke lesson, time is of essence when it comes to bleeding. The more blood lost, the more the individual, or the less it is likely that the individual will survive that incident. So if you find someone in a car accident, or in whatever, and they're bleeding, the first thing you should do is stop the bleeding. Don't try to take pictures. Don't try to start screaming for help. Yes, you can call for help, but make sure you act really fast, okay? All right, so the next I want to talk about is puncture wounds, cuts, and impaled objects. Now, puncture wounds, let's say you have a nail puncture. You're walking in the backyard, for instance, and then something just goes right through your skin, under your feet, and then you're not sure what it is. So depending on how deep the puncture is, you might try to take it out. But if it's really, really deep, to the point where it might be pinching on nerves and blood vessels, you just want to leave it in there and find your way to the nearest emergency room. Try to tie a gauze around it to stop bleeding, and with the material still in there, because if it's something that is really deep, and you try to pull it out, that person might bleed to death. So you want to leave it in there and rush the person to the nearest emergency room. Now, if it's not really deep, maybe like a little pin, or a piece of bottle, like a tiny piece of bottle, yeah, you can just try to take it out, because in those cases, there's not going to be a lot of blood loss, right? So you want to make sure that, if there's a little puncture, you can take it out and then go see a doctor. Now, if it's something really deep, do not try to touch it. The patient needs antibiotics, they need tetanus shots, they need a whole lot of other things from their doctor's office. So you try as much as possible to preserve the tissue. Okay. Now, let's see. The next I'm going to talk about, I already talked about, impaled objects that go really deep into the skin, leave them in place. It's very important to understand that you just need to stabilize that object until the doctor is able to attend to them. All right, so the next I want to talk about is eye problems. Yes, we've had people, in the course of cooking, they had something splash in their eyes, or they're playing and they had some acid, or something, whatever it is in the eye. We have a lot of people who come to the emergency room with this, eye pain. They start having red eyes, they're watery eyes, they're having bleeding, maybe a little bit bleeding in the eye. And sometimes it could actually cause a laceration, a tear in the eye. So when you have like an irritant, anything that irritates the eye, the first thing you want to do is flush the eye. Pour a lot of water, open the eye, make sure you flush the particles away from the eye. Don't try to blink and blink and blink and try to move things around in the eye. It could actually get stuck. So try to wash as much as you can with water, and even if it's chemical, just try to wash as much as you can, and then protect the eye. If you have an eye shield, you want to cover the eye. And usually, because both eye move together, so it's hard to cover one eye without covering the other one. If you cover one eye, the other eye is going to keep moving, and the one covered is going to be moving in the direction of the uncovered eye. So most times it's better if you can cover both eyes, but then try to explain to the person why you're doing that, so that they don't wake up and freak out because they think they can't see. So try to cover the eye with an iPad or whatever, and then take them to the doctor's office. So if I've seen cases where people come in with impaled objects, like a huge stick stuck in the eye, maybe they were in the mowing the lawn or something, or cutting the trees, and some particle falls and goes straight into the eye. Yes, it's possible, but again, you don't want to pull it out. Just leave it in place. Go to the nearest emergency room for immediate help. All right, so I'm very fast. I'm trying to make sure I don't take too much time, but of course, if you have any questions while I'm talking, please do not hesitate to ask me. I'm not that mean. I will answer your questions. All right, the next is head injuries. Okay, let's assume Young John is in the field playing, and all of a sudden falls down, hits his head, or he gets kicked in the head, or someone involved in was involved in a motor accident, or trying to cut a tree and falls down and hits their head on the ground. What do you do when somebody falls and hits their head on the ground? What do you do? So in cases like that, the person might pass out, they might be confused. Don't freak out. It's nothing for you to start trying to figure out at that point. The most important thing you want to do is stabilize the person, make sure they don't have any further injury. So if they fall down and the neck is tilted to one side, you want to make sure that you stabilize the neck, keep it in place, protect the back, protect the spine from any kind of curvature. Don't try to twist it, don't try to turn the person. And if you have to turn the person away from a dangerous environment, you want to log roll. What I mean by log roll is rolling the individual from head to toe all at once. You don't want to roll the head first and then you roll the leg and then you roll the trunk. No, you want to log roll. Roll the head, the body, the legs all at the same time. That way the spine is stabilized. Okay, and then of course you want to prepare for the the most available emergency transport to the hospital. Okay, spine injuries, we've seen a whole lot of them from falls, car accidents, sports events, and most physical activities, even in the gym. Now head injuries can also accompany spine injury. So someone breaks hits the head on the floor, and then a part of the spine is also, it could affect the spine, because what happens, the head is connected to the rest of the body. So this we might find ourselves we're trying to protect them, we're trying to do this and that, but of course, like I said, the most important thing, the first thing you should do when someone has a head or a spine injury is to prevent further damage. As much as possible, keep the body and the spine in one spot, keep it in the same direction. Don't try to start messing with the person, turning them back and forth. Okay, so injuries to the spine can be very unstable, and most times if it could actually result in permanent paralysis if time is not taken and if things are not handled properly. And that's why I kept emphasizing on the importance of maintaining the spine and the head in one position. Now, when performing first aid on someone with a spine injury, do not bend, flex, twist the person's head or neck. I already said that. If they start vomiting, keep the head in the same spot, but you can log roll them to the side, because when they're vomiting, you don't want them to aspirate on their vomit. So you want to turn them to the side so that as they vomit, it just comes this way instead of going back into the throat. So stabilize them as much as possible and call 911 or whatever emergency number you use in your country. All right, so for bone and joint injuries, the first aid care for both of them include ensuring that the scene is safe, apply gauze. So if there's a bone breakage and there's bleeding, you want to apply gauze, clean the environment, make sure that you put some pressure, do not allow excessive bleeding. Now, the last thing I want to say about bones is, please, if someone has an injury where the bone protrudes through the skin, I know it probably comes to your mind to, hey, pop it back in. No, don't do that. So if that bone broke to the point where it caused a laceration or it came out of the skin surface, then you cannot try to push it back, because what happens, there are going to be fragments inside of the skin, and you don't want the individual having any kind of any kind of complications from that. So try as much as possible, stabilize the area. If possible, if you can make a splint, something to prevent further bending or pressure, whatever, just to help that extremity, use a splint, support it, and get the person to the nearest emergency room. Okay, so an open or compound fracture occurs when there's a break through the skin. Like I said, do not attempt to push the bone back or try to straighten the extremity. Bones that are in an abnormal position should or bend should be splinted. Like I said, do not attempt to manipulate or correct abnormally positioned. I know back in the days, back in the days, back when we were little kids, someone is playing and then they kind of pop an ankle or something. What we hear is pop, they just push it back in place. Yeah, but don't do that. It might not be very safe to do that because you need to know the extent of damage that occurred in that bone. So, and only the doctor can tell you, with some whatever radiology or whatever, So don't try to do that. Okay, so when dealing with an amputation, and when I mean an amputation is a severing of any part of the body, okay? So you're cutting your vegetables in the kitchen and you just cut your finger along with it, right? Nice, but it's not nice. So you're trying to cut your vegetables and then you cut a part of your finger. Yeah, you cut your finger away and you're looking at your finger, dangling around on the table, right? What do? You don't want to start screaming and getting overwhelmed. What you should do is pick up the remaining part, rinse it off, get a bag, a clean Ziploc bag, put it in the bag, zip it up, and put it in ice. Okay? Get the remaining part of the severed or amputated part of the body, rinse it off, make sure it's clean, it's still bleeding, it's fresh, put it in a Ziploc, put it in a cup of ice or a bag of ice, put your name and the name of the person who has that part, because it could go missing, right? So label it, and the person has to go to the emergency room or to the doctor's office with that part. It's very important because I've seen people come to the ER and they have a severed finger, and you're like, where's the rest part of the finger? They're like, oh, I threw it away in the trash can. Well, if we don't have it, and if it's not in ice for a while, ice preserves it. If it's not in ice for maybe 20-30 minutes, it dies. Okay, so you don't want that part of the body to die, and that's why you put it in ice. Okay, so I'm talking really fast because I'm out of breath. I'm running out of breath a little bit. Okay, so for burns and electric injuries, like I said earlier, you want to make sure that you get yourself away from danger. Now, if there's an electric injury, do not try to, grab onto the person, because what happens, the person could actually still be transmitting electricity, okay? So try to make sure that the area is safe, there's no more source of electricity, and then the person is brought to safety. There's no water. If there's fire, you want to make sure that you keep the person away from fire. Now, the first thing that I want us to know in case of a fire is how to put the fire out. So if someone is wearing a cloth and they're burning, or they're not even wearing a cloth and they're burning, what do? Don't try to fan them. Don't try to get them running. No. Ask them to drop on the floor and roll. So the floor serves as some kind of like a blanket. It kind of helps put the fire out. But if you have in your body, your clothing burn and you're running, then you're supplying oxygen. And what does oxygen do? You're fanning the fire. The fire is going to keep spreading. So when there's a fire, the first thing you want to do is drop on the floor, roll as many times as possible until the fire goes out. Now, if you cannot drop and roll, if you have a wet blanket, you can just wrap the person up with a wet blanket. It helps put the fire out. And as soon as the fire is out, please take the blanket away, because they could have some hypothermia, which is some really low temperature. Okay, so burns can occur from direct and indirect contact with heat source, electricity, or certain chemicals. Burns can vary from minor superficial burns, like when you're ironing your clothes and you burn yourself just a little bit. It hurts, but so you hurt yourself a little bit. And then it can also be up to the point where there's a damage in the muscles, tendons, nerves, and even the bones. So high voltage electrical injuries can also produce devastating burn injuries and can be really, really fatal. So like I said, stop, drop, and roll. You can also smother with a wet blanket and then remove the blanket when the fire is out. So small burns can be treated with first aid. Ensure that the source of the burn is being dealt with. There's no more, you're not going to be treating a burn and the person is still burning, right? So you want to make sure it's safe. Wash your hands. Rinse the burn in cold water. Rinse it with cold water. I told my son yesterday, I think he burnt himself while trying to make some eggs for dinner. And I said, run your hand under cold water. Now, cover with clean, non-sticky dressing. And if you have a burn cream, you can apply it on it. Don't apply ice. Don't put ice directly on a burn, because it could cause a cold injury. All right. Now, when there's a large burn that affects the muscle, the inner layer of the skin, the nerves, or you can see the bone. I've seen burns where people were really burnt. don't try to do anything. You can send them to the emergency room, protect them, because at that point they're not able to control the body temperature. So protect them from cold. If it's a cold environment, if you have the luxury of turning on the heater, just warm the environment up a little bit, and protect them. If they have clothes and jewelries or anything that is restrictive, you want to take it out. If anything is in the way of them breathing, take it out. Don't keep them to a point where they're dealing with the burn and then they can't breathe at the same time. All right, so I will talk about CPR, but that will not be today. I'm trying as much as I can to keep the lessons really, really short so that you can understand and you wouldn't be too bored watching the video for 2 hours, So yes, I will keep the CPR class for next week. But right now, this is all we're going to be talking about, just little emergencies. And let me know if you've learned anything from today's presentation. And yes, I have a YouTube channel. Like I said last week, it's Edith Declan. You can always go and you have access to all of my previous videos. I've been on quarantine, and that's why I'm making the videos from my bedroom, right? I have my little, I'm trying to set up a little like a mini studio upstairs. Yeah, I'm trying my best. I'm giving this my best. I'm not very good at it. This is not my the production part of it is not my specialty. I have a harder time setting up my cameras for this than I actually have talking about it. Thank you so much, Dr. Kenneth Iwuji. I really appreciate you. Thank you so much for your kind feedbacks, for the you are simply amazing. Thank you so much. Thank you all for joining. Thank you, Ugoma, Nancy, Gabby, Mr. Gabby OKK, Edith, my namesake. Thank you so much. Oh my God, I have a whole ton of you watching. Thank you all so much for this is something that I just love to do. I just try to bring out time from no time. I work a really busy shift, and but I really love to do this. And in the last 2 weeks, I've been really down, but I've still tried to make sure that this was not interrupted by my illness. So like I said, if you know how to make better videos, if you know how I can make this better and more informative, more educative, please, I am very open. I love to learn. I want to know. I don't know beyond talking. So please, if you have any idea how to make this more professional or even professional, because I know it's not. So if you have any ideas, please let me know. I will really appreciate it. But until next week, thank you, Titilayo, for joining. Thank you, Mr. Eze. Thank you all so much. You all make me feel so fulfilled when you watch my program. Until next week, I will reserve the CPR for another day. I'm not sure yet, but I will definitely love to do CPR. I was going to do that today, but I'm on quarantine and my son cannot come in here. I was going to use him as my patient for my CPR class because I want to make sure that I am actually performing the CPR and y'all are seeing how it is supposed to be done. So, but until next week, thank you for joining me, and you all have a wonderful, wonderful week ahead. Have a blessed one. Bye-bye.